Behind the Mask, the podcast. Behind the Mask. Behind the Mask. With Dr. William, the OGEE genius. Behind the Mask, Dr. William. The more you know, the better you do. Behind the Mask, the podcast.
Such a great song. I enjoyed that very much.
I love that song too. It was done by Roxy. Roxy is just a superstar.
Well, thanks, Roxy. Listeners, welcome to a new episode of Behind the Mask, where you'll learn everything you need to know before having plastic surgery, because the more you know, the better you look. I'm your host, Gabby Allen, and with me, of course, the man behind the mask, Dr. William. Hi, how are we doing today?
Hey, Gabby, how are you? I'm doing well.
I'm great. I've got my coffee now, so I'm buzzing a little bit.
Yeah,
Is
I got a
it
little
the
buzz
right
too.
spot?
I like it.
My shaken iced espresso.
Yes.
It's wonderful, yeah.
Shaken, not stirred.
Absolutely, always. Well, today's topic is a very popular hot topic right now. I think a lot of our listeners will be interested in. And I'm talking about BBL, Brazilian butt lift. We're going to go through the whole process, what you need to know, what you should prepare for, concerns, questions. We're going to hit it all. And just so you guys know, I myself have actually never had plastic surgery. So we're going to be learning.
Newbie.
Yes, I am. So I'm genuinely, my questions are genuine. We are going to be learning together the whole process, because I really wouldn't even know where to start. So we're going to begin right there. What would you say is the first thing? I'm a potential patient. I'm sitting at home. I'm thinking, I really would like to enhance my behind. I would like to lift this booty.
Yes.
Where do I start?
I mean, that's it. I mean, that's what we want to talk about today. Is this operation it's a big operation. I mean, it's a full liposuction. So I do liposuction all over the front, the sides of the body, all of the back, take that fat and transfer that fat to your butt. So it's called a Brazilian butt lift. It's really not a lift in of itself. It's more like an augmentation. And so, we call it a liposuction with fat transfer. It's like an augmentation of the breast. It makes your breasts larger. It doesn't lift them. An implant doesn't lift your breasts, and neither does this operation, but it's super powerful at really helping to not only just, shape your body because of the liposuction, but then you're adding the fat to the legs and the butt. So it's big in terms of the recovery and going through it. This is not something you have on a Thursday and then you're going to a wedding on Saturday. This is something that takes, several weeks to recover from. And I think it's really important to really know what you're getting into before having it done. And so that's really what I want to talk about today is, when you first decide, all right, I'm going to go down this avenue and have a BBL, what do I do? So,
Google.
Yeah. So, yeah, I mean, Google is super helpful, but I don't think that there's, at least from whatever I've been able to see, there's not like kind of one source that tells you. And that's kind of the information that I want to get out. I make a lot of videos for Instagram and YouTube, and I enjoy doing those. But I think this is the type of things better just to kind of talk about. So the way I like to start is kind of what to do when you first decide you want to have a BBL. And the very first and most important thing, and I think this sometimes get overlooked because people want to know what medications do I take, what vitamins do I take, all that stuff. But you really need to kind of stop at the very beginning and focus on eating clean and exercise. Okay. So those are kind of the two things. And what do I mean by eating clean is just cutting out all of the processed foods and eating whole foods. So stay towards the outside of the grocery store and not on those inner aisles, and get yourself to a healthy weight. And when we talk about weight, the BMI always comes up, the body mass index, and I'll talk about that later. We'll kind of revisit that, but it's more important just to get yourself to a healthy weight. The other thing that I think is really important too, and when you first decide you're going to have a BBL, you're going to have some time, obviously, depending on how close your surgery is. But, usually patients will have a couple of months to be able to prepare. And one of the things that I recommend is going on an exercise program. Now, you always have to be careful of who's giving you advice, So I don't really look like the eat clean exercise person. I do eat clean, but the exercise that I usually recommend patients, the reason I do is because when you recover from any surgery, but particularly this operation, it really depends on your heart and your lungs.
Okay.
That's going to carry you through.
So cardio?
Cardio. But I think starting just a very graduated walking program is simple for people to do, and it's really easy to execute. And so what I usually recommend to patients is take your iPhone, set your timer, walk for 15 minutes in one direction, turn around, walk back home. That gets you 30 minutes of exercise. Do that 5 days a week. But go further each time you walk. So if you've walked to this certain intersection, well, the next day you're gonna at least cross that intersection. Yeah. So you're forcing yourself to walk a little bit faster each time. So you still walk for 30 minutes. You just do that faster. That's really good. And that type of interval training has been shown to really rapidly improve your cardiac fitness.
It also, I think, helps with mental health. I'm a big walker, and it will help you overall with
Totally.
everything. Yeah.
Yeah.
Only positives there.
Yeah, it's good for everything. Okay, so once you kind of eat clean exercise program and getting your weight down, then there are some supplements that you should be taking. And though these supplements are all designed to improve your hemoglobin. Do you know what hemoglobin?
Tell us, what is our hemoglobin?
So
it's our blood.
Hemoglobin is in the blood,
Yes.
right? So hemoglobin is just a way for us to measure what our red blood cells, which is what carries oxygen to and from our tissues, and it's a way to maximize that. And there are some people that naturally have a lower hemoglobin for whatever reason, and if you take vitamin C and iron and folic acid, those three things will really help your hemoglobin for most people. It's not a cure-all for everybody that's anemic. So if you really are struggling with anemia and, it's been a problem for however many years or whatever, and it's not solved with those three medications, then you'd want to see a hematologist. Your doctor would recommend that and figure out, why you're anemic. But for most people, just what I usually recommend is taking the vitamin C and the iron. I recommend 325 milligrams of iron, the ferrous gluconate, 3 times a day. And then you take 250 milligrams of vitamin C at the same time as you take the iron because it helps you absorb the iron.
All right. Add that to your shopping list, guys.
And then the folic acid is 0.4 milligrams, and you just take that once a day.
Okay.
So that's what you do. From a supplement point of view, I don't think you really need any other vitamins or anything else. As long as you're eating clean, you're going to get all of those other micronutrients and things like that just out of eating like a, orange or rutabaga or something.
Are there any clean foods that a patient should stay away from?
No, not really.
Like,
I really don't think there's anything they have to avoid as long as they're eating. When you talk about clean, it's really just fruit and vegetables and whatever meat source that you want to have.
And fried chicken.
Fried chicken is
just for fun.
It's fantastic. It's one of my favorite things.
Me too.
Yeah, that I don't think would be considered clean.
So no fried chicken.
No fried chicken.
Just on the weekends.
Okay, and then the other thing you do is you want to stop smoking.
Yes.
So in people always wonder, like, why do you ask patients to stop smoking? So for certain procedures like a facelift, a tummy tuck, a breast lift, as a plastic surgeon, and this is kind of a rule for all plastic surgeons, we won't perform that surgery if you are smoking. So facelift, tummy tuck, breast lift, because in those operations, we're really upsetting and disturbing the blood supply to that area where we're operating. And smoking, the nicotine is a vasoconstrictor, so it causes the blood vessels to constrict. So if we're already disturbing the blood supply, you might tip it over into having really healing problems because the vasoconstriction.
Okay.
So
how much time would they have to go without smoking?
So I usually recommend 3 weeks before
Okay.
and 3 weeks after
Okay.
surgery. And you can't use a patch, because the patch is delivering the same nicotine that's causing the same problems. If you have a breast augmentation, then that's fine. You can smoke. It's not really going to we're not going to have a healing problem from it because it's just small incision. We're not really disturbing the blood supply. It still is better if you stop smoking before
In general.
any surgery. Well,
Just for
in
your
general,
overall health, right?
obviously. But in every surgery, it increases your risk of problems with healing and infection and all of that. So stopping smoking. Now, marijuana is different. I don't mind if my patients smoke marijuana.
That was going to be my next question.
Well, it's really helpful.
Yeah.
I mean, it's been used for years. I mean, I can remember one of my, an old family friend who had a lymphoma and was undergoing chemotherapy, had horrible problems with nausea. And that was really he was a veterinarian, and the only relief that he could get was through marijuana. So it's helpful, but when you consume it, do not do it in a vehicle that has nicotine in it.
Okay.
So that's important to understand. And it's also a good anxiolytic. So I'm okay if people use it postoperatively for nausea, vomiting, anxiety. And I've had lots of patients who will tell me that they've used marijuana to help them recover, and then they don't even use pain pills.
Yeah, that's definitely a much better alternative.
Yeah, it's good. It's not for everyone, but
Yeah.
if that's something that you're accustomed to, then it's fine with me. Okay, and then so you're going to make some of those lifestyle changes. You're going to
Sure.
take those supplements, and then there's a whole host of other things that we need. And so most of these things are going to be within 30 days of your surgery.
Okay.
So you're going to have a set of labs. Okay, and that's where we look at your whole blood, how your kidneys work, how your liver works, how your blood clots, how your thyroid is, make sure you're not pregnant.
So would you recommend these lifestyle changes to happen before that first appointment or consultation? Or because that's what we would tell them in that consultation, right?
Yeah, I mean, I think, if you know that you're going to be doing this, then the sooner you can start, the better.
Perfect.
And it's a better lead in.
So then you go into...
Yeah, and then as you get closer, then we'll order all of these labs for you.
So let me ask you what makes a good candidate versus not a good candidate? If I come to your office, would I be considered a good candidate for this procedure?
Well, I mean, you're healthy. So that's number one, that we want to make sure that people don't have medical problems and all those other types of things. And then you have to have sufficient fat. You may kind of fall down on that one.
It's okay.
But you want to make sure your skin is okay to undergo liposuction, not have too much extra skin, for example. But providing that you have sufficient fat and you're healthy and your skin is good, then you'd be a candidate. And then after we institute all those lifestyle changes, and then we check your labs. One of the other labs we look for is what we call the A1C, which is a lab that looks at your long-term glucose levels in your blood. So for patients that have diabetes, we would want to make sure that their A1C, which was what tells us their glucose has been good, it looks at a 3-month period. It's a little marker on your blood cells, and it kind of tells us your blood cells have been swimming in your blood, and that's where the glucose is, and it tells us how high or low your glucose has been. So we want to make sure that's fine. And we also get an EKG, which looks at your heart. And I just want to talk about, we touched on a little bit about the hemoglobin and the diet, but sometimes I'll see patients come in and they're otherwise healthy, but they'll have a low hemoglobin, but then all of their other what we call blood indices are off, like how big their new cells are and a bunch of other things. And I think a lot of that is just diet related. So if you're eating a highly processed diet, and your body's trying to make new red blood cells because you're low on them, you're not giving them the correct nutrients. So you don't really overcome that with a vitamin. You overcome that with just clean eating. So I mean that's just super important.
And let me ask you too, really quick.
Sure.
Let's say we're at our first initial consultation
Yeah.
here. Again, I have no idea if this is something that actually happens other than if I were to go into like a photo editing app and just zoom in and really increase my butt on there.
Yeah.
Like, is there a way to kind of simulate or see what I would look like post-surgery to kind of see, like, do people worry that they're not going to like the result, or if there's certain sizing, how does sizing work compared to when you have,
Yeah,
breast
I mean,
augmentation?
that's obviously a huge concern for patients. I think that I've, at least in my mind, I've kind of simplified that process, because we're not at a point right now where we can take photos and put you in a software. I mean, there is software out that exists for that, and I've used software, but it's just, you can never really recreate an imaging in a software program or with Photoshop or whatever. You just can't recreate what you can do in surgery.
Okay.
And so I think sometimes, I mean, when I've used software before, sometimes I think my results are better, and sometimes I think my results are worse.
Oh, okay.
Because we're relying on the patient's tissue.
Okay.
And so there's no real button in a software program they can say, like, okay, super great tissue or poor tissue or these types of things. So it's very hard to come up with some type of software program that will do that. I mean, maybe at some time they will. But so, the other thing that patients do is they tend to then say, okay, well, I like this picture and I want to
So
look
they kind
like
of come
this.
to you with a size or a
Yeah, like a wish
aesthetic.
picture,
Yeah,
it's
okay.
called. And
wish picture. Okay.
yeah,
Get your wish pictures.
it's wish pick, really.
Wish pick.
Yeah. I don't look at them.
Oh, just kidding. Do not get your wish pics. Keep them to yourself.
So, well, I don't look at them because they're not realistic.
Fair.
So what I really just advise patients is, I say, I have this style. My BBLs are what I call an OGEE BBL, which is, this concave and convex shape. And that's the look that I like. That's how I perform the BBL. And so I really can't deviate from that. And so I usually advise patients, listen, if you like this appearance, then I'm your surgeon. If you don't like that appearance, then I'm not your surgeon, because, you can't come in and say, like, I want this, do this, because it just doesn't work that way.
Right.
And so, unfortunately, there's a bit of a leap of faith, you know, and I try to be as straightforward and as realistic and honest during the consultation and say, listen, this is going to be a problem, or this is a limitation. Almost every single person has some limitation. Sure. I like to go over that just to make sure that their expectations are in line with what I have.
Then that, I'm sure, brings a happy patient throughout the process, and especially with the results. And I know if it were me sitting there, I would want, to know potential risks and everything, so there aren't any surprises.
No, I mean I'm the same way. I want to be informed. I don't want things sugar coated or
only my donuts.
Yes. And I don't want, so I'm really, what I learned a long time ago is, and it happens still to this day, not really very much in my patient population, but if somebody's unhappy with their surgery, it's simply because their expectation was not met. Now, you can have somebody that has a really good result. Like, you would look at the patient, other plastic surgeons would look at the patient and be like, wow, that's great. And they can be unhappy. Yeah. Because they may have had a different expectation as to how they would look.
It's like getting bangs. It's a great idea. And then you get them and you're like, oh no. And you have to remind yourself.
And then you get in that awkward growing out stage.
Yeah, we've all been there.
So, that's, I think, the most important thing is setting those realistic expectations. But getting back to kind of some of the things to do in terms of preparing. So one of the blood tests that you'll get is looks at your how your blood clots. And obviously we want to operate on patients that blood is clotting normally, because that's what's going to prevent you from bleeding to death.
Yes, we don't want that.
And so, we'll look at that. But it's interesting because the blood that test doesn't really tell you if the blood clots too much. And that can be a problem for forming a blood clot. and that blood clot can go and break off and go to your lungs and cause you big problems or potentially be fatal. So we also want to screen for that. So we don't have a good blood test for that, but most of that screening is just based on history. And so we'll ask you, have you had a blood clot before? Yeah. Sometimes patients will have multiple miscarriages, like 5 miscarriages. And the reason is because they actually have their blood clots too much. And then we call that a hypercoagulable state. So, coagulation is your blood clotting, hyper is too much. So they have a hypercoagulable state. And so a lot of that we we find out on history. But if you do know that you have like a protein C or protein S deficiency, something called factor V Leiden, thrombophilia, these types of things, that would exclude you from being a candidate for surgery, because we never want to undergo an elective operation and knowing that somebody's at
of course not.
Increased risk. Now, if you come in, if you get struck by a car and you have your liver's lacerated or something, you have to have surgery. Well, we can't be like, well, I'm sorry, you can't. You've got protein. In the hospital in that situation when it's not an elective operation, then we'll take other, tacks to try and get through all that. But for elective surgery, if you had any of those coagulation problems, that would stop you. Something that comes up too is sickle cell disease. That's where the hemoglobin, the red blood cells rather, they're shaped like a sickle, like the.
Yeah. I actually do remember learning about this in 10th grade biology.
Oh yeah, you know why? Because it's all genetic. It's usually they teach genes, they teach genetics and inheritance patterns and stuff based on that.
So I learned that, and obviously that the mitochondria is a powerhouse of the cell. And those are my big takeaways from high school.
Good for you. I mean, I did my undergraduate in cell biology, so really got into the whole mitochondria, the whole minutia of the powerhouse of the cell.
Wow.
Well, that's good.
So then you will definitely know more about that than I do.
No, I like mitochondria. They're very good.
You do. I love a powerhouse.
Yes, who doesn't? So the sickle cell, if you have a true sickle cell disease, then you would not be a candidate for this. But sickle cell trait, it's fine. It just means you're a carrier of the disease, but you don't actually have the disease.
Okay.
So that's something too. We also look at, and I mentioned that briefly, about the A1C. That's that little marker on the red blood cells. And we have a cutoff of 7. If your A1C is above 7, then we have to wait to do your surgery until because it just indicates that your glucose has not been well controlled. If it's above 7, and we want you to have as normal a glucose level as you can, because if your glucose level is too high, imagine your blood is kind of like sweet, if you will. There's glucose in it, and that makes it a better environment for bacteria.
And vampires.
And I don't know, vampires like sugar.
I think they would like sweet blood, right?
Maybe.
But BBLs do not.
No. So we want to decrease your risk of having a problem by having your A1C. And, with A1C comes, you can have either diabetes type 1 or type 2. For us in Florida, and I don't think all states are like this, but certainly in Florida, we're not permitted to operate on a patient with type 1 diabetes in the office.
Well, it's really helpful, I'm sure, to a lot of our listeners, because I know, or I imagine you guys get so many patients. Like you were saying, Miami is like the mecca for plastic surgery, especially BBL.
Yes.
So people who travel from out of town for these,
Yeah, and you hate to have somebody travel in with type 1 diabetes,
and they're not able to.
We can't do that. Okay, so those are kind of all the lab tests and things that we like to have.
So we got our blood work. We've got our labs. We're healthy.
EKG.
We shop the perimeter of the grocery store.
Yes.
And I go on my walks.
Yes.
Blood levels good. No sickle cell. What's next?
Okay, so what's next is what medications to avoid.
Okay.
Before surgery. So you want to avoid.
How long before surgery do we start?
Well, that's a little bit variable depending on the type of medication.
Okay.
But in general, 2 weeks is
Okay.
is a good number. And some of these decisions, like if you're on a medication and you're going to stop it, you can't make that decision on your own. You need to do that with
Consult with your doctor or a
doctor.
medical professional.
Exactly. And but simple things that are over the counter that are not prescription, like aspirin, Motrin, Aleve, these types of things, you want to stop because you may take it for a headache,
but they're blood thinners.
They're blood thinners, exactly. So you
don't want the bleeding.
No, you have to stop all of those things at least 2 weeks before. The only thing, let's say you're 2 weeks out from surgery, and you get a headache, you can take a Tylenol. Because Tylenol doesn't contribute to any bleeding. But there are some medications, and I've got kind of a laundry list. I'm just going to read some of these ones out. Phentermine, we have patients stop. That one's probably one you're going to want to stop 30 days before. Phentermine is a diet supplement, and it's an amphetamine, which will limit your craving for food. I'm not a big fan of it because I think it comes with its own host of complications.
Sure.
And but anyway, that can appear on a drug test. That's the other thing we do during the day of surgery is we do a urine test.
That's a very interesting fact.
Yeah, and it's it comes up. There's lots of stories surrounding drug tests, and sometimes.
Especially with professional athletes too.
Well, I can tell you sometimes some of the patients are like professional athletes in terms of bringing other urine to us to test and things like that. And we've got some interesting stories there. But
I think all interesting stories start with urine, right?
Well, with this urine test, if you're taking phentermine, the urine test doesn't know if it's a prescription drug or it's a recreational drug.
Right.
And so it'll turn your drug test positive, and we can't do it. So you have to stop phentermine a month before. There's other medications, and I'm not going to go into detail on a lot of these, but for patients, they're taking methotrexate, Enbrel, Plavix, Coumadin. Those things are all kind of things we either have to stop or can't even perform the surgery on some of those. With some of those medications. Prednisone is an important one. Do you know what prednisone?
I've taken. That's the only name you've listed so far that I've actually.
That you're like, oh, that I know.
I was like, wait, I know this one.
Yeah. So prednisone. What did you take it for? Something like breathing problem, maybe?
Yeah. So I have asthma. I've had it my whole life. So it's gotten better, but especially when I was younger, and anytime I got sick, my asthma was my lungs would always be hit worse than anything, and it would last the longest. And say with my mom, would get respiratory infections really easily. Yeah. So that was also a concern with COVID. But so I've been on prednisone. My mom even more than me.
Yeah. So and what you just described is pretty common, and that's usually why it's prescribed. But it's a steroid, and steroids are very powerful drugs, and they're the most powerful anti-inflammatory. And so they are very well known. We've known for decades now that prednisones will really limit and interfere with wound healing. And so it's a complete no-no. But you can't just, if you're on prednisone for some longer period of time, you can't just stop it.
Okay.
Because it's a steroid and your body naturally makes steroids. But when you take the steroid, your body's like, oh, we don't need to make as much. And then when you don't make as much and we operate, your body's not able to kind of rebound, and you need the steroids and things like that. So
do you have to wait cutting out or cutting off prednisone? Is that longer than a 30-day window?
No, it's not, but it has to be tapered.
Oh,
it has to be done.
So your body is it shocked with where did all of it go?
Exactly. So 1 minute you're taking this amount, you can't all of a sudden just drop it,
right? Because
your body has to like make up the difference as you taper it off. So that's done under your physicians. Now, something that comes up a lot of time are either anxiety medications or antidepressants. Those medications you do not want to stop.
Right.
So they're not harmful for your surgery, but it is harmful if you stop them.
Right.
So it's best to, I tell
In
patients.
general, even without surgery, it's not.
Well, yeah.
It's not great to stop.
Exactly, that's true. But anything like Ativan, Xanax, Zoloft, Effexor, Paxil, those medications, and they're fairly common. I mean, a lot of people are on those medications. So I tell patients on those medications, just continue to take those medications like you normally would. Don't stop them. So you can take them if you take them in the night, on the evening after you've had on the day of your surgery, you can take them in the evening like you normally would. So all those medications are very helpful. Particularly, I've had patients that have anxiety, and so they're taking an anxiolytic for either an Ativan or Xanax or something, and then they'll, naturally people want to stop medications for surgery. That's kind of the de facto. They're worried that, if I take my Xanax, it's going to interfere with anesthesia or something. It's not, so it's safe to take them. But I can tell you the worst thing is if you have some anxiety and you're accustomed to taking anxiolytic and then you stop.
It's going to be a rough ride.
It's a rough ride. And then we put you on an even bumpier ride because we're now like, okay, now you're going to have surgery, which makes you nervous.
Yeah, I was just about to say, surgery is already so anxiety-inducing.
Yes.
Even if you're not somebody who's prone to anxiety, you're
nervous.
Going under the knife.
Yeah.
You're still...
You should see me going to the dentist. It's like...
Oh, you don't do well at the dentist?
No.
Oh, wow.
Yeah, I do now because
Dr. William, no match for the dentist.
No. So he's got to, bring out some of the big guns for me. And it's really helped me realize like how debilitating anxiety can be.
Absolutely.
And how you don't have any control over it.
Nope.
I can rationalize in my mind, okay, I'm going to the dentist, not a big deal. He's just going to do this or whatever. But as soon as that smell of the drill starts coming.
My mom is the exact same way. Look, this podcast, we even cover mental health awareness, which is so important.
No, it is. I mean, really. And so I have a lot of respect for anxiety in that situation. Sometimes, for patients that need it, I'll give them a little bit of Valium that they can take like the night before.
Especially
even the day of.
For you gorgeous women who are electing this elective surgery, so you're almost choosing to put yourself in this anxiety, kudos to you, because I'm too anxious to even do that.
No, it does. I mean, and that's why I think the preparation is really important because you don't want to be in a situation where you're trying to do everything last minute. That's anxiety provoking in and of itself.
Yeah. And I think if you take care of your mind too and have the right mindset and your body feels at ease, that's the best way to go into any surgery.
It completely helps in recovery. It helps in
everything.
Your
your
whole process.
Yeah.
Well, if you come into surgery and you're really wound up because you haven't been taking your Xanax that you normally take, I mean, everything is higher. Your heart rate's higher. Your blood pressure's higher. You're breathing faster. And the catecholamines, which is your adrenaline that circulates in your body. I mean, we need adrenaline. We wouldn't be alive without adrenaline. But, we've all had that experience where your heart quickens and things like that. And so, if you stop those things and now you come into that environment, all of that machinery is revved up. And I really, really strongly believe that affects your recovery a lot, even like a week later, because you're just starting so charged up,
Absolutely.
Okay, moving through this laundry list. Other things to continue to take, not just the antidepressants, the anxiolytics, but you're also going to continue if you're on high blood pressure medication, you're going to continue to take that.
Okay.
You're going to continue to take, cholesterol medication, thyroid medication, all of these types of things. So the general rule is most of the things you can continue to take. And I think people have the opposite sort of impression. So just those medications that I recommended stopping and all of the anti-inflammatories, you have to stop. If you're on kind of usual medications, thyroid, blood pressure, anxiety, depression, those types of things, you continue to take them.
Okay.
I do want to talk about a little tiny bit about asthma.
Okay.
And we mentioned with the prednisone that you're going to stop taking prednisone under your doctor's direction because we don't want to
do that safely. Yes.
Yeah, you have to do it safely, and we don't want the healing problems. But you mentioned asthma, and I want to talk about that briefly because that can be a tricky problem.
Okay.
If you develop asthma, what happens is your airways constrict and shrink down.
It's a great time. Yeah.
Yeah, and it can pose a problem with surgery. So you have to really make sure that the asthma is well controlled.
Right.
If your asthma is not well controlled, or you're on like 3 or 4 medications, or you've been to you have to get hospitalized or anything like that, it's probably better just not to have elective cosmetic surgery, is my advice.
Good to know. And that's just for your health and safety.
Yeah, I'm really strict with it. I mean,
Yeah.
the reason is there's not too much we can do. Like
Right.
if you have a bad asthma attack, during your surgery, it's much harder because we can breathe for you.
Right.
But if everything's constricted, it doesn't work. Yeah, it limits it. So, but if you have like well-controlled asthma, it's fine. But bring your inhaler.
Bring your. That's just a good thing to
It's a
keep
catch-all.
Yeah, life lesson. Just every day, bring your inhaler.
Don't leave home without it.
Don't leave home. I never do. Always keep that inhaler handy. Well, before we move on, I think now's a good time to take a little break.
Yes.
And move into a new segment we call "Let's Get Surgical."
Let's get surgical, surgical. I wanna hear the doctor talk.
That was a really fun jingle. I wish
I like
it was
it.
longer. That was
I like
fun.
it.
All right, Dr. William, for
Yes.
this one, fans, you guys are going to get a look into a little bit of the behind the scenes of your
Oh.
experiences, Dr.
Okay.
William, right? This is your chance to share a real life story with us. And so today I would like to know
What is
about
that
your
story?
very first BBL surgery.
That's a good question. Well, let me just preface this by saying, none of my answers are short.
Okay.
None of my stories are short.
We have learned that.
But no, I mean, you remember a lot of these things clearly. I remember my first BBL patient that I did, and actually she turned out really well. And she
Were you
looked,
nervous?
Nervous is not the right word, because when you become a surgeon, you've gone through, so many operations, thousands of operations.
You have the confidence. You've done it.
Yeah, you're not afraid of operating. You can handle things. But I did do a lot of preparation. Looking at her photos and talking to her, and I was very forthright with her. I said, "Listen,
Did she know?
Yeah.
Wow.
Well, I'm not going to perform something for the first time and not have. You have to be open, and
That's true. That's fair.
and so I felt comfortable performing the operation. It was an operation that I wanted to start performing. If you go way back in time, and when I was when I was at Duke, so this would have been like 2004, 2005, something like that. I first heard about a BBL when I was at a meeting in Chicago. It was a great meeting, but towards the end of the day, they tend to put some of the talks that people maybe not as interested in, because if it's the last day of the meeting, people are catching flights and they've already checked out of their hotel and they're leaving. And so that was kind of like the case here. It was like a 4:00 meeting with Dr. Mendieta. He's a surgeon here in Miami. He's phenomenal. And he gave this talk about a BBL. And I was just like, wow, this seems amazing to me. You're going to remove the fat and then add it. And his results were spectacular. And so I went up to him after he gave his lecture, and there was just a handful of people in the crowd. Picture like a large open room in a hotel, big ballroom, in Chicago, one of the big hotels. And then there's like 6 people in the audience. But it was very early. Yeah. And, he was really a pioneer. And so I went and I asked him, like, hey, this seems amazing. Would you mind? Because as a resident at Duke, we were allowed to go and work with other surgeons, like for elective time kind of idea. And so, I went to Miami and he taught me how to do BBL and showed me these things. So when I started practice, the BBLs were not, I don't think anyone was doing them, where I was practicing. And this patient somehow found out that I did it or wanted to do it or offered it. And anyhow, she came in. So I was very upfront and said, listen, I've never done this before, but I feel comfortable operating and feel comfortable. Liposuction is obviously done a lot of that already, and she turned out great. And she was such a good, like, had a great personality. She's like, yeah, no problem. I've seen your work. I like what you do, and we kind of had a good experience. So she looked great, and everything went really well. And I saw her probably like 5 years after that. She came in for a different procedure, and still looked really good.
Oh, that's great.
Yeah.
That's a very positive experience.
Yeah, it was fun. It was
She's a
good.
real
to go
team
through
player.
that.
She said, "Your first time, my first time. Let's
Yeah.
learn this together.
Yeah,
Let's
she
hope
was-
for the best."
I know. She was really cool about it.
Well, I hope she's doing well, and we know she still looks great, so that's even better.
Yeah, so that was really good.
And I'm assuming she was probably an ideal or perfect candidate.
Yeah, so that's
I'm sure it was important to you also being your
right,
first time.
right, and that was sort of part of our discussion. And you have to, listen, for plastic surgery, this is so key is patient selection. So
Yeah.
you're not going to start off with the most challenging BBL you've
Yeah.
ever done as the first one. So yeah, she was somebody that you could hit a home run with, and without too much problem. So
Does a woman's age affect if she's a good candidate or not?
that's a good question. The short answer is no. If you look at like anesthesia risk, age in and of itself is not a risk factor. So you can have somebody who's 50 and they're not on any medications. They've got a healthy, BMI and everything else. Then they can be a better risk, lower risk than somebody who's 35 and on a bunch of medications and obese and all the other things. So as a general rule, if somebody's over 50, I'm going to get medical clearance with them. But just being over 50 and being healthy, it's fine to have surgery. Oh,
nice. Well, and let me ask you this too, because I
Yeah,
don't know
sure.
if this is a myth or not. I am a redhead. Does
Yes.
the hair color affect the anesthesia and how effective it is during surgery? Is that a true thing, or have I just been
No,
making it
that's
up?
that's interesting that you'd bring that up, because I don't think I've ever had anybody with red hair ask me that question.
You know what? I've heard it, and it was probably because my mom also has red hair and my grandmother had red hair. So
Yeah.
it was just, I don't know, this was just bestowed upon me, this piece of information. So anytime I've had one surgery in my life, and I remember being like, okay, but make sure I have enough because
Yeah, no,
apparently
it's well.
I can conquer the anesthesia with this hair.
Usually the problem. I mean, in medicine, there is like a myth. Like if somebody is bleeding, okay, more than typical, and they have red hair, then everyone's like, oh yeah, she's a redhead. And so
Really?
yeah,
So there's some truth behind it.
no, there isn't.
We just pretend there is.
But that's the kind of stereotype.
Okay.
And the interesting thing is I grew up that way too. Like we would operate and they're bleeding, we're like, oh, this is a redhead, They have
Oh, there she goes
freckles.
again.
Yeah, redhead, freckles, light skin. But there was a surgeon, I can't remember where he was from, and I read this paper a long time ago, but actually looked at incidents of bleeding during surgery in redhead versus non-redhead, and found out there was no difference between
so there's
your hair
nothing
color.
special there.
There's nothing to do.
Myth
so.
busted here.
Yeah,
Myth
that's a
busted.
myth busted.
Well, since we're talking about me right now, this is, I guess, a good opportunity to circle back to my asthma and other patients with asthma and how that affects their experience going through or potentially having BBL.
Yeah, I mean, most of that kind of legwork is done up front. Making, if you come in and you're on a bunch of medications, you've had a bunch of problems, then I usually just say it's probably a better idea not to have elective surgery. I've never had a problem where I've had to admit somebody to the hospital because of asthma, just because I'm so proactive with that.
That's right, guys. He's a great doctor, great surgeon.
Well, I mean, you have to realize, like, when we do elective surgeries, we want to minimize risk.
Yeah, absolutely.
And that's one of the reasons why, if your BMI, for example, is too high, it can set up a whole bunch of problems in terms of blood clots and healing problems and everything else. So I use a rough guide to BMI, but BMI is just not that specific. So I usually say if your BMI is 35 or less, you're a candidate. But there definitely are patients that have a BMI of 31, and I have them still, lose weight. Or every once in a while, I'll have somebody whose BMI is like 27, and you'd think they'd be a great candidate, but they have a lot of internal fat. So BMI is helpful, but it's not like it's just like it's a rough.
It's not the end all be all
No,
of determining.
you really need to see the person.
Oh, okay. Well, so I guess with certain things, again, with your candidacy for this, it is case by case.
Yes.
Patients.
Oh, yeah,
like there's not
definitely.
just one outline. So
No, these are just general guidelines that
Sure.
to kind of help everybody.
So then what comes next? I have the proper medication. I'm not stopping my anti-anxiety or my depression. So we've had the surgery, or are there any steps before the surgery has taken place now?
So, I mean, that's going to get you all, personally in good shape. I will just say that there's going to be one other thing that I think you should start thinking about at this point is talking to your caregiver,
Okay.
because this operation is messy.
It's a team project.
It is a team project. I'm serious. It really is. Like, you have to have somebody who's totally in, and I don't know if the spouse is always the best person. I know personally when my wife had tummy tuck and lipo, like, I knew that I was not going to be the best person. Her mom was a nurse, is a nurse, and looked after her. But you have to get right with your caregiver. You have to pick somebody that is going to be, there with you 24 hours a day, and you have to prepare them and tell them, like, listen, you're going to be leaky after surgery. I mean, you lose a lot of this fluid that we put in to do the liposuction. That comes out. That's tinted with blood. Blood is like food coloring. So, like, you put like a little drop of red and,
Yes.
making cupcake icing or whatever. It's going to look like you're bleeding. And so it can be really it can make someone freak out.
Okay.
So you have to prepare your caregiver and say,
If you're not good with blood, maybe you're not on the caregiver list.
You're not on the list.
Also sounds like a real test of loyalty and love for whoever you choose.
No question.
Maybe you should go through an interview process with whoever you want to be your caregiver.
I don't know if you have to go that far, but you definitely need to consider.
Somebody who loves you unconditionally is probably a good caregiver.
I think that's probably like the best thing. So I think if you do all of those things, then you're going to be, in pretty good shape and pretty well prepared for your surgery.
Well, that's great, guys. Now you know how to be properly prepared. And, from this episode, I'm sure you can tell for the most part if you would be considered a good candidate or not. And at this point, you can go forth with more research, or obviously Dr. William on his social media. You can do your own research and get a lot of helpful tips from there. But of course, always consult with a medical professional, of course.
Obviously, yes.
Well, before we wrap up this episode, we can't leave without, of course, spinning the real OG wheel.
The OG wheel is going to make its appearance again.
It's the wheel time.
I think I like the music of the wheel.
I love everything about the wheel. I love how she struts her way onto the.
She takes her time.
Onto the scene. She does.
She's in no rush.
Ooh, I wonder what we're gonna get today.
Oh, I'm just hoping it's not TikTok.
It's gonna always be TikTok.
It's gonna be like, maybe you've rigged the wheel, so it's just gonna be like a TikTok wheel.
That's a secret I'll never tell.
All right, let's see what are we gonna have today?
All right, do you want to spin it this time? Do you want me to spin it again?
No, you spin it.
All right, let's see if I can get a good spin. Here we go. Here we go. Here we go. Ooh.
Oh, what does that say?
Beauty pageant question.
Do you ever look at someone and wonder what is going on inside their head?
All right.
So, Dr. William.
Yes.
Welcome to our beauty pageant. Our pageant.
Thank you.
Our medical pageant, right?
Yeah.
We are going to ask you an actual question that has been asked to beauty pageant contestants in the past. So this is a real...
Oh.
Everything's weighing on this.
Okay.
And you cannot
I'm a
just say
contestant.
world peace. That will not be acceptable here.
Okay.
All right.
That's a good solution answer for everything.
Isn't it?
Though.
Isn't
Yeah.
it? All right. We've got our options here. Our official beauty pageant bowl of questions. Do you want to pick the question? Do you want me to pick it?
No, you pick it.
All right. Because I've done so well picking the things on the wheel, right?
Yes.
All right. Dr. William.
Yes.
Which profession deserves the highest salary and why?
Oh, wow.
Take a moment, think it over. There are some wrong answers.
There are wrong answers.
Well, that's our job to judge.
Well, I think salary is all based on, skill and the amount of people that can do that.
So would it be better if we said highest or best compensation?
I would say, I'm going to be biased,
It's okay.
and I'm going to stay with the medical profession. I would say a neurosurgeon.
Oh, okay.
Because
yes.
if you've got somebody that's messing with your brain and operating in there, I don't want them to be thinking about making their mortgage payment.
Yeah, I wouldn't either.
No, I want that excluded. There's no financial worries, and they're just operating on my noggin.
I love that.
So I'm going to go with that. I'm going to go neurosurgeon.
You know what? That's a safe, good answer. I love it. And I think we're going to crown you today.
Ah, great.
Well, let's take a listen to the gorgeous beauty queen who did answer this question, and let's compare the answers, shall we?
Wait.
Since I'm very close to my mother, I think a mother deserves the highest respect. And when you talk about salary, I don't think it's just about cash, but I feel it's the love and respect that you give to someone. And I think my mom has always been the biggest inspiration in my life.
You
and
should.
Yeah.
Hopefully your mom's
all
not listening.
mothers, they just sacrifice so much for their kids. So the profession which deserves the highest salary, the highest respect and love, I should be.
I hope
of a
she
mother.
comes in number 2 with neurosurgeon.
Thank you, India.
You know, I don't think she gives a backup answer, but you know what? Actually, I just got word that was her second choice. If they said what would be second place, it was neurosurgery. So good job.
Oh, okay, good. Thank
Nice.
you.
That's close enough,
Yeah.
right?
Mothers.
You know what?
of
I'm going to be
course.
honest. I think we're going to make her the winner, but how does runner-up sound?
I'm runner-up.
Okay,
That's fine.
perfect.
There's
Well,
still duties for runner-up.
There, absolutely.
And I'm not exactly a pageant expert, but I do think there's been controversy over the years gone by,
Yeah.
and the number one gets knocked out.
You're right.
Yes.
Maybe there's a scandal.
So the second one comes in.
Yeah.
Okay. I'll
This
live
is
with
your
that.
chance.
Yeah,
All
I'll
right.
take it.
Well, there you had it. You just heard it from.
I've never been on a beauty pageant before.
You haven't?
I-
I haven't either.
Is that shocking to you?
It is shocking to me,
I would
actually.
think that you would be like one
That's
of those
fair.
pageant kids.
Really?
Yeah.
What gives you that impression?
Well, you're, spokesmodel.
Oh,
and,
thank you.
And a model.
That's
and,
true. Thank you.
Yeah. So
I don't know if I could do pageants, but maybe one day. I like the ball gown. I'm sure you would enjoy a ball gown as well.
sure,
Absolutely.
beautiful.
Well, more on our pageant dreams next time. But thank you
Yes.
guys so much for watching. Thank you for listening. Dr. William, thank you for all of the insight. I do feel more prepared, and I'm sure a lot of our listeners and viewers do who are interested in potentially having a BBL. And of course, you should seek out the best himself. But until next time, don't forget to like, subscribe, comment any topics you want to hear, or if you have any other questions, we can always revisit to answer those because we care what you guys think. And until next time, I'm Gabby Allen. This is Dr. William, and we'll catch you on the next episode of Behind the Mask.
You're about to experience Behind the Mask, the podcast.